So my name's Greg Wynn. I'm a consultant surgeon in Colchester. That's part of the bigger trust with Ipswich. And I'm a general surgeon with a specialist interest in colorectal surgery. That means we do both elective and emergency surgery anywhere in the abdomen. But most of our elective work is dominated by bowel cancer, gallstones and hernias. So why did I become a doctor? Well, that's a very good question. I suppose I was always interested in dealing with the general public. I'm interested in meeting people. I find other people fascinating and their lives and their stories. But I just happened to be quite good at sciences as well. So it was a natural marriage, really, to bring those two together. And so I thought I'd give medical school a try. I got in, and the longer I was there, the more I enjoyed it, really. And once I was on that conveyor belt, it was very easy then to whittle down the various specialties on offer. And it became very apparent to me that surgery was the thing for me. Fixing things with your bare hands was, there was nothing better than that in the world. So I was lucky enough to grow up in the middle of the countryside in Suffolk, enjoying a rather idyllic childhood. And it was, having been around most of the southeast of England and in London as well for my training, it was a joy to come back to this part of the world, actually. I get a real sense of security coming back to where I grew up and finally working here. So it just enhances the quality of my life now working in and around East Anglia. So the greatest rewards from my job are seeing people who have distressing symptoms, I think, and being able somehow to improve the quality of their life. That occurs in emergency surgery first and foremost, but also in elective surgery as well. In emergency surgery, I think that's the most satisfying because people are at their most vulnerable and desperate. And quite often there's the greatest amount to be gained by your actions, particularly in surgery, especially if you get a good, uncomplicated outcome for them. So that's incredibly rewarding. And I think patients are very, very grateful in that situation as well. So it's a very humbling experience. So I think patients like me to tread that fine line between giving them confidence in someone who is competent to look after them without stepping into complacency or arrogance. And that comes with experience, I think. I think you have to have been around for a few years to know the balance between the risks and benefits of what you're doing, and to bring the patient on board and have a joint decision-making process with them. So patients appreciate that approach, I think. They don't like being talked down to or patronized. They like being involved in the decision-making, and I think that's really a top priority for me. What I see in patients is someone who needs to have a good outcome from their care. And I think someone who is realistic about their expectations is really important to me. So it's the same as being on a journey together, really, in reverse. You know, they've got to come with me and I've got to go with them. I don't use a catchphrase or a mantra. I think I have described my principles of practice, certainly. I respect the patient's autonomy, and it's very easy as a clinician to impart your own biases onto the patient and their situation, and we don't listen enough to patients. We tend to prescribe things to them, but I think listen to the patient and respect their views and opinions, because they're usually right. So the challenges of being a general surgeon are manifold. I think having enough time in the working week is a big problem. We not only do we have to see patients, prepare their surgery, see them afterwards, We have to do endoscopy, we have to run day surgery lists, we have private practice to do. There is a huge amount of paperwork now, an increasing amount of that. There's also keeping up with an ever-changing and evolving specialty, including the evidence base for surgery and all the technological advances as well. So yes, it's quite a job to keep everything on the go at the same time, but rewarding at the same time. So it's a really good question how we deal with our own difficult situations. And traditionally there was very little training for doctors in this area, but we're getting better at it, and it's about both education for clinicians and also gaining experience and knowledge about yourself. Having been through a number of very difficult scenarios, particularly in the operating theatre, particularly after long and complex cases, I've recognised that being tired does affect my assessment of the situation in terms of managing the staff around me, my decision making, and I've learnt to recognise that in myself and take appropriate action. And so, like a lot of surgery, it's about hazard recognition, and that's how to prevent bad outcomes and complications, and that applies to you as an individual as well as the patient.